Hello all, in this video we will see about CPITN index, that is Community Periodontal Index of Treatment Needs. This question can be asked as a short note for you, and it is good to know this for your practical examination also. In public health dentistry, this is an important topic which you need to know about. So moving on into the topic, CPITN was developed by Joint Working Committee of World Health Organization and Federation Dentaire Internationally, shortly known as WHO and FDI, in the year 1982. The Joint Working Committee included the following people. So the purpose of CPITN is to identify the actual and potential problems, that is in periodontal diseases, and it is a screening procedure. Basically, it is done at community level and individual level. The advantages of CPITN is that it is simple, it is usually quick to calculate, and it has an international uniformity because of the instrument used here. We will see about the instrument later. The limitation is that it does not record the position of the gingival margin. They are concerned about pocket depth and calculus alone, but not the position of gingival margin. That is, recession is not calculated here, and does not provide assessment of past periodontal breakdown, whether they had any surgery or those kind of things or details are not recorded here, and it is not a diagnostic tool. Therefore, treatment planning is not accurate and appropriate here. It is only to assess the treatment needs and not for specific treatment planning. So you have to remember that it is a screening tool and it is for treatment needs alone, and it is not a diagnostic tool and it is not for treatment planning accurately. The dentition is divided into 6 sextants, that is into 6 teeth. From canine to canine, upper canine to upper canine, lower canine to lower canine of right and left, premolar to 7 on each side, which will divide your dentition into 6 parts, 6 sextants. Each sextant is given a score. Clinically, the highest score in each sextant, that is each individual tooth, is examined, and the tooth with the highest score is calculated for the sextant. But in epidemiological survey, it is difficult to calculate for each tooth. Therefore, the index teeth are calibrated. So what are the index teeth? The upper right upper central incisor and left lower central incisor, along with either 6 or 7. In adults, that is greater than 20 years of age candidates, 10 teeth are examined, that is 6 and 7 both are examined, and the highest score is noted. In less than 19 years candidates, 7 is not examined, that is the second molar is not examined. In children less than 15 years of age, pockets are not recorded, and the probing is only for bleeding and calculus checking. The instruments used here are mouth mirror and CPITN probe, also known as WHO Periodontal Examination Probe. This probe was specifically designed for this index. So what is this probe? CPITN probe, or the WHO Periodontal Examination Probe, was designed in 1978. It was designed for two purposes: measurement of pocket depth and detection of subgingival calculus. The calibration of these two is important for CPITN index. So how does this probe work? This probe has a thin handle. First of all, it is of very light weight, 5 gram, which makes it easier to handle. The color coding is that there is a black mark from 3.5 to 5.5 mm. So this marking will help you with the measurement of pocket depth quickly. So if the pocket depth is more than 5.5 mm, this black mark will not be visible, so the dentist can easily record the probing depth. The ball tip has a diameter of 0.5 mm. The purpose of the ball tip is that it facilitates the identification of base of the pocket, that is, it decreases false recording, and easy detection of subgingival calculus is also possible because of this ball tip. The light weight along with the ball tip helps in the identification of the base of the pocket, as I said already. The variation of the basic probe is that there are 2 additional lines included. In certain probes, there are lines included here which is used in clinical purposes at 8.5 and 11.5 mm from working tip for recording deeper pockets.